Dear students, today we'll discuss a topic which is very common, which we come across in day-to-day surgical practice. See this thumb, you can that yellow area, you can already just made a nick and there is pus there, there is swab actually for culture. This is the typical of Paronychia thumb. It's the most common hand infection. Paronychia means, look at that, Paronychia means run around the thumb, around the nail bed actually. So that is meaning, see that it occurs due to minor injury it can occur, or any infection, maybe through water, whatever it is, by contamination, usually gram-positive like Staphylococcus and Streptococcus, and because of the floating nail, very severe excruciating pain, throbbing pain they will have, and sometimes fever, chills will be there, you can't work, you can't move the finger, and tender axillary lymph nodes sometimes palpable. So very typical, very common. Look at the pus, color of the pus, yellow pus, very typical. So severe throbbing pain, tenderness, independent position, and tender nail. And it's very clear cut to diagnose. It's a clinical diagnosis. Only thing is nail may get dislodged and may have to remove the nail, and new nail will come later. Treatment is always drain the pus under ring block anesthesia. When you give a ring block anesthesia, use xylocaine 1% or 2%, but never use xylocaine with adrenaline. It's very important. Thumb or fingers or toes will go for gangrene or ischemia because they are end arteries, lethal vessels. Same thing in certain areas like in ear lobule, tip of the nose, and while doing circumcision, in penis, wherever end arteries are there, you never use xylocaine local anesthesia with the adrenaline. You have to use plain xylocaine. That point you have to remember in which all sites you will use only xylocaine plain without adrenaline. Now pus should drain for culture sensitivity. Of course, before draining, you have to always start conventional broad spectrum antibiotic because you have to drain an abscess under the umbrella of antibiotics. Now, if nail is dead, it's floating, it has to be removed. Of course, new nail may come. Again, important thing is patient may be diabetic, blood count, C-reactive protein, maybe if you are still and rigors, otherwise not necessary. And of course, rule out diabetes. Then once you drain the pus, things will feel very fast. Send the pus for culture sensitivity. Remember, the gram-positive organ is a common thing. So, answer this MCQ. Chronic paronychia is commonly due to Staphylococcus, A, B, tuberculosis, C, Candida infection, D, nocardia. Students, put your answer in the comment box. I will give the answer later, tomorrow. So students, always go through my SRB clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic, for example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on, all topics with the video. Contain lot of photos and illustrations. So students, thank you very much. I hope you understood this topic very well. Thank you very much.